October is Breast Cancer Awareness Month, and often very overlooked are the very side effects of treatment that many don't see, which is of course the severe impact on the skin. In South Africa, breast cancer is a harsh reality for many women, and while chemotherapy and radiation attack the disease, they also leave behind wounds, scars and even deep skin damage. And this is more than just a cosmetic issue. It's quite a critical part of the patient's healing journey. And here to shed light on why skincare is so vital during and after treatment, and to also offer us expert evidence-based advice, is Biomedical Scientist Dr. Judey. Dr. Judey, it's a pleasure to have you with us. Thank you so much for your time. So these often unseen or overlooked side effects of cancer treatment are actually an integral part of how a patient recovers. It can lead to depression, slow healing, or even low confidence issues on these individuals. How would you even advise a patient on dealing with them as part of their healing journey?
Afternoon to all our viewers. Well, you know, the human skin is such a dynamic organ. It's a very public organ, and you know, it's one of those organs that's definitely a diagnostic organ as well. And what do I mean by that is certain diseases can actually be picked up by looking at some of the expression on human skin. For instance, heart conditions, you'll be able to pick up on deep swelling in lower extremities, and even blue lips, for instance, due to a lack of oxygen and so forth. And the same is for cancer treatments. But what happens during either the early stages of a cancer patient or even more a progressed stage of cancer treatment modalities is the first thing is the sensitivity. So they will definitely experience sensitivity, and the sensoric activity of the human skin is just absolutely amplified. And what do I mean by that? Physically, if you go outside and the wind just blows, you feel it so much more intensely. You feel heat, elevated temperatures, and low temperatures so much more intensely. There's of course, skin rashes that takes place. And another thing that takes place is the fact that the skin just does not have the ability to retain moisture. So unfortunately, when individuals go for these type of treatments, they lose a lot of moisture, they experience severe dryness and also severe pain during all these treatments. And if we can break it down, what are some of the treatments that cancer patients get is of course radiation, they get chemo, and also immunotherapy. And some of the oral medication that they drink is what we call cytostatic medication. And what do I mean by cytostatic medication? Cyto means cell and static means to stop. So you can just imagine these patients are struggling with tumors. Now they're going specifically for treatments to stop any form of cell division to take place. And why this has such a great impact on the human skin is because the human skin wants to divide in different cells. So there wants to be cell divisions from 2 cells to 4 cells to 8 to 16 and so forth. So that's why when you go for these treatments, it stops any form from cell division or proliferation to take place. And that's why it's so intense for these individuals. And like you've said in your introduction as well, is some of the treatments that a cancer patient has to go through will ultimately cause a wound. Now, during Breast Cancer Month, many ladies who struggles with breast cancer have to go for a mastectomy, or they have to go for a lymphectomy, for instance, or just biopsies. And if the skin is already compromised and the immunity is down, it's not high and strong, then the chances are very likely that these patients will develop hypertrophic and keloid scars from forming. Some of the chemo treatments that they actually get is so intense that if it leaches on your skin, it will actually cause blistering to take place.
Doctor,
radiation.
Yes, doctor. I mean,
Yes.
maybe just while we're on that, then what type of additional products or even practices then do these patients have access to as they go through this treatment? Does that require also additional experts? For instance, if one had surgery to remove a tumor, can a patient opt, for example, oncoplastic or reconstructive surgery? And would the cost be part of the initial procedure to remove the tumors, or is it separated? We know already that cancer treatment is exorbitantly expensive as it stands.
Well, as it stands at this point in time, if we're talking state hospital patients, they are on a waiting list to get chemo and radiation. And what's so sad is that they actually succumb to their wounds. There's some wounds that these individuals struggle with. We call it fungating wounds or ulcerating wounds, where it literally tears through the skin as the tumor starts to grow, and that wound becomes septic, and unfortunately these patients die because of the wounds and not necessarily the cancer. And you're right, it's so expensive. You know, now I'm talking about some extra treatments that these cancer patients need to get, to survive. But what I've tried to do and our company tried to do is to do pro bono work and teach these patients just how to treat those wounds. Because sometimes if you and I have a very big wound and it starts off as an acute wound and then converts into a chronic wound, which is very, very serious, we think that we need to clean that wound every day. We have to go through daily wound dressing changes, but in actual fact, it's not necessary. So we try to coach these patients by getting certain wound care products that's fairly inexpensive, that they can apply onto the wound bed and close it for at least 3 days, 72 hours. And then we coach them and their family members how to do the dressing changes. And surprisingly enough, some of the people that we managed to help all through the years really made a remarkable difference. And we were able to bring a turn in all of those wounds and really help those patients, not with cancer, but without a doubt the wounds.
That is great news there, Doctor. I mean, I understand that the Cancer Association of South Africa also offers additional services like counseling and navigating through the public healthcare system. Are these extra post-op services available at these public facilities at no cost? And how does it actually work? I mean, through your experience, especially for those who simply cannot afford private care or don't even have medical aid.
I can tell you, any individual who's been part of any cancer patient's journey can tell you right now, it's such an emotional and taxing experience that you literally want to do whatever you can to the absolute maximum to help these individuals. And we have although our public sector is under pressure, and although yes, there is a long waiting list for these patients, you do find counseling at multiple clinics. You do find guidance, not only for the patient itself, but also the patient's family, because they also go through a very taxing experience. It's emotionally draining, it's physically draining, it's spiritually draining. So from churches right through to some of the hospitals and clinics, they do have online support mechanisms. They do have clinicians that provide pro bono support. And like I say, even us, we love to provide pro bono support where we can. We're not able to deal with everybody, but every person that you can touch and make an impact is really so worth it.
Well, thank you so much for the wonderful work that you're continuing, Doctor, and thank you so much for that meaningful engagement with us. That is Dr. Judey, who is a biomedical scientist there, on the importance of skin care during cancer treatment. So this now a new pilot program, the Minibus Taxi Executive Leadership Program, has been launched in the Western Cape to foster strong, capable leadership within the taxi industry.